Hi guys, my name's Elaine Power. I'm the clinical director here at the Starr Wellness Group. And today we're going to be talking about a question I hear really frequently from folks asking inpatient or residential treatment versus outpatient treatment. Is there a difference in terms of what's more effective? What works? Is inpatient better? Do I have to go to inpatient? I hear this a lot because there's a very common idea that that's what substance abuse treatment is, that folks go to rehab. Well, we're going to be busting that myth today. So a little bit of background first. We're talking about intensive outpatient programs, or IOPs. What's an IOP? It's a level of care for substance abuse treatment, an alternative to going away to residential. For an IOP, a person stays at home, and it's typically a longer length of treatment, 6 to 12 weeks, and generally more cost-effective than residential as well. It's defined as having at least 9 hours of clinical service per week, up to 19 hours per week. Here we offer 3 days of 3-hour groups and 1 individual session per week. We've got morning and evening options too, by the way, so that people can work with their schedules. In the IOP programs, they provide a mix of education, structure, social support, accountability, relapse prevention, coping skills, managing our relationships. We've all heard this, that it takes a village, and when a person is trying to make a change, it's really helpful to have a team, people that they're checking in with often, people giving them support, people holding them accountable. And it tends to be a very helpful experience for folks. So that's what IOPs are. So that in terms of what the study found, the results were that for both residential and outpatient programs, they were effective. And that meant that there was a substantial reduction in alcohol or drug usage and a period of abstinence after the treatment. And the real kicker is the residential programs were not more effective. There was no bonus, no boost, no measurable improved outcome for people who went to residential versus people who did an IOP program. So the big takeaway, and this is good news here, IOP programs are as effective as residential programs. And we think that's great, because that means that for your average person who's looking for substance abuse treatment, you don't have to go away. You can stay in your home, stay with your family, and kind of do treatment where you're at, in a more cost-effective way too. We think it's very freeing, very good news, with the little caveat that there are some folks in some situations where residential may be necessary if there's serious medical complications or grave emotional instability, risk of suicide, gravely dangerous living situation, that kind of thing. In that case, residential may be the more appropriate level of care. But when you come in, we'll do a screening call, and I'll kind of be listening, checking out for any of those kind of situations, just to make sure that we would be the right level of care. That answers the big question, guys. Thanks so much for tuning in. If you have any questions, call us here at the office or leave a comment below. Thanks so much.